Hello everyone, my name is Anusha Anand, working as a tutor in M College of Nursing. Today in this video, we will discuss about radiation therapy. Radiation therapy or radiotherapy is the use of various forms of radiation to safely and effectively treat cancer and other diseases. Radiation therapy has been an effective tool for treating cancer for more than 100 years. About two-thirds of all cancer patients will receive radiation therapy as part of their treatment. Let's see a brief history of radiation therapy. The first patient was treated with radiation therapy in 1896, just 2 months after the discovery of the X-ray. Rapid technology advances began in the early 1950s with the invention of the linear accelerator. Planning and treatment delivery advances have enabled radiation therapy to be more effective and precise while decreasing the severity of side effects. Radiation therapy. What is radiation therapy? Radiation therapy, also called radiotherapy, is a cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumor. At low doses, radiation is used in X-rays to see inside your body, as with X-rays of your teeth or broken bones. How does radiation therapy works? Radiation therapy works by damaging the DNA within cancer cells, destroying their ability to reproduce and causing the cell to die. When the damaged cancer cells are destroyed by radiation, the body naturally eliminates them. Normal cells can be affected by radiation, but they can repair themselves in a way cancer cells cannot. When is radiation used for a patient? The best treatment plan for each patient is frequently determined by a team of doctors, including a radiation oncologist, a medical oncologist, and a surgeon. Sometimes, radiation therapy is the only treatment a patient needs. Other times, it is combined with other treatments such as surgery and chemotherapy. Let's see the purpose of radiation therapy. Mainly, there are two purposes: to cure cancer and for palliative. To cure cancer, radiation therapy destroys tumors that have not spread to other parts of the body. To reduce the risk that cancer will return after surgery or chemotherapy, shrink the cancer before surgery. For palliation, shrink tumor affecting quality of life, like a lung tumor that is causing shortness of breath. Alleviate pain or neurologic symptoms by reducing the size of a tumor. Oncology team. Now we will see who all works in the oncology team. They are radiation oncologist, medical radiation physicist, dosimetrist, radiation therapist, radiation oncology nurse, additional member of the team. Radiation oncologist. Radiation oncologist oversees the radiation therapy treatment, including working with other members of the radiation therapy team to develop the treatment plan and ensure that each treatment is given safely and accurately. Medical radiation physicist. ensure that complex treatment plans are properly tailored for each patient, and directs quality control program for equipment and procedures. Dosimetrist works with the radiation oncologist and medical physicist to calculate the proper dose of radiation given to the tumor. Radiation therapist administer the daily radiation under the radiation oncologist prescription and supervision. Radiation oncology nurse cares for the patient and family by providing education, emotional support, and tips for managing side effects. Additional members of the team: social workers, nutritionist, dentist, physical therapists, and patient navigators may also assist in a patient's care during their treatment. Now we will move on to the types of radiation therapy. Radiation therapy can be delivered either externally or internally. External beam radiation therapy typically delivers radiation using a linear accelerator. Internal radiation therapy, called brachytherapy, involves placing radioactive sources into or near the tumor. Now we will see types of external radiation therapy. The types of equipment used will depend on the location, size, and type of cancer. First, three-dimensional conformal radiation therapy, that is 3D CRT, a technique where beam of radiation used in treatment are shaped to match the tumor and are delivered accurately from several directions. Second, intensity modulated radiation therapy, that is IMRT, a form of 3D CRT in which the physician designates specific doses of radiation that the tumor and normal surrounding tissue receive. Third, proton beam therapy, a type of radiation therapy that uses high energy beam rather than X-ray to treat certain type of cancer. Most commonly used in the treatment of pediatrics, CNS, and intraocular cancers. Fourth, stereotactic body radiotherapy or stereotactic radiosurgery, a specialized form of radiation therapy that focuses high power energy on a small area of the body. Despite its name, radiosurgery is a treatment, not a surgical procedure. Radiosurgery generally implies a single high dose or just a few high dose treatments. Internal radiation therapy. Radioactive material is placed into tumor or surrounding tissue, also called brachytherapy. Purpose is to deliver high dose of radiation to the desired target while minimizing the dose to surrounding normal tissues. Radioactive sources used are thin wires, ribbons, capsules, or seeds. These can be either permanently or temporarily placed in the body. Now see types of internal radiation therapy. Intracavitary implant. Radioactive sources are placed in a cavity near the tumor, that is breast, cervix, uterine. Interstitial implants. Sources placed directly into the tissue. Example, prostate, vagina. Intraoperative implants. Surface applicator is in direct contact with the surgical tumor bed. Brachytherapy dose rate. Low dose rate brachytherapy is delivered over the course of 48 to 120 hours and is typically used to treat prostate, breast, head and neck, and gynecological cancer. High dose rate brachytherapy is delivered in minutes rather than days and is typically used to treat certain type of gynecological, breast, head and neck, lung and skin cancers. Some prostate cancers may be treated with high dose rate brachytherapy. Permanent vs. temporary implants. Brachytherapy is delivered through permanent or temporary implants depending on the cancer and location. Permanent implants remains in the patient and eventually lose their radioactivity. An example of this is prostate seed implants. Temporary implants may require hospitalization and are left in the body for several hours to days and are then removed. An example of this is high dose rate breast implants. Intraoperative radioactive therapy or IORT. IORT delivers a concentrated dose of radiation therapy to a tumor bed during surgery. The advantage of this intraoperative radiation therapy, it decreases volume of tissue in boost field. Its ability to exclude part or all of dose limiting normal structures increases the effective dose. Multiple sites can be used like pancreas, stomach, lung, esophagus, colorectal sarcomas, pediatric tumors, bladder, kidney, gynecological cases. Several recent trials have shown efficacy for breast cancer. Systemic radiation therapy. Systemic radiation therapy uses radiopharmaceuticals given by injection or intravenously that collect where the cancer is and deliver their radiation to kill the cancer cells. Some of the radioactive isotopes used are listed on this slide. Side effects of radiation therapy. Most side effects begin during the second or third week of treatment. Doctors and nurses may prescribe medication to help with these side effects. Side effects like skin redness are generally limited to the area receiving radiation. Fatigue is a common side effect for all cancer patients. Side effects may last for several weeks after the final day of treatment. Side effects can again be divided into acute and late stage. In acute, the patient may have nausea, vomiting, skin desquamation. In later stage, the patient may have fibrosis, alopecia, lymphadenoma, pneumonitis, cancer, and cardiac problem. Now let's see the summary. Radiation therapy is a well-established modality for the treatment of numerous malignancies. Radiation oncologists are specialists trained to treat cancer with a variety of forms of radiation. Treatment delivery is safe, quick, and painless. This is all about my video. See you soon with new topic. Thank you.